Howdy everybody, this is Randall Loy from Central Florida. You've reached me on the Infertility Channel and I thank you for being here. I hope you're enjoying the Infertility Channel and I'm getting lots of great questions. This is Viewer Mail Thursday. We love Viewer Mail Thursdays and any second now I anticipate, oh, I like this. I love it. Okay, well, guess what just flew in? Questions. Let me see, we got 1, 2, 3, 4. Some of these are fairly lengthy. So Catherine from College Station, Texas. Now I have not seen these, really. So my GYN told me I have endometriosis, but didn't give me any specific reasons why. She wants me to do laparoscopy. Should I do it? Well, that's a good question. It really is. So endometriosis, we've talked about that time and again. It's a chronic inflammatory disease state of the pelvis. It can be associated with pain with intercourse, bowel movements, urination, especially periods. Can one know about endometriosis prior to doing surgery? Is that the only way? Well, there are some suggestions. If there's a family history of endometriosis, and if there is a history of those symptoms we just talked about, that's suggestive. If there is free peritoneal fluid on ultrasound examination, in other words, if there's fluid between the back of the cervix and uterus and the colon, if there's fluid in that cul-de-sac space, that's suggestive. All of those things put together, and maybe a CA-125 test, which is the so-called Gilda-Radner test, not specific for endometriosis, a blood test that can be suggestive. So all of those put together, kind of, it's like a jigsaw puzzle, and the more pieces you put together, the more you get the picture. And your doctor may have put most of those pieces together, might have a pretty good picture that you do have the disease. The only way to really know, of course, is laparoscopy with biopsy of the endometriosis lesions. Going back to my airplane here, Leslie from Spokane, Washington. My best friend is going through IVF and she's become so hard to be around. She's become angry and disconnected. Is it me or is it your fault? My fault. I don't even know her. I suspect that you mean that it's the doctor's fault putting her through IVF there in Spokane. All right, so no, I have a friend here in town who says, you have the worst job in the world. You pump these women full of hormones and you expect them to be normal. And I think I have a great job actually, but it is possible to become hormonal. It is possible when under the stress of IVF to disconnect a little bit, to kind of just not be the same person one may have been prior to the IVF setting. So basically give her some room, know that you're there for her, be her cheerleader, ask her what you can do to make her life easier, and I guarantee you that her anger and her disconnectedness will fade after the cycle, whether she becomes pregnant or not. In fact, if she doesn't become pregnant, she's going to need you. So be there for her and help her through this. Okay, next is a question from Melissa in Chicago. My partner and I are going to go through IVF. Is there anything that we should be cautious about in choosing a sperm donor? Is it better to go through an agency? Are there reasons not to ask a friend to donate? Wow. This is a great series of questions. Are there reasons not to ask a friend to donate? Quite possibly, yes. You really need to have, I think, the assurances of a bonded sperm bank, a cryobank, where you know that the sperm donor is healthy, he's been through a history and physical examination, he has had sexually transmitted infection screening for hepatitis B and C, cytomegalovirus, he's had testing for syphilis and HIV, he's then given specimens after those tests were cleared. He has to come back 6 months later to have those tests repeated. So you know that after quarantining those specimens for 6 months, they're safe. So as much as you think you know somebody, you really don't. So definitely use a sperm donor from a bonded cryobank. I think that's all I'm going to say about that. Okay, Mitch from Boston. My wife is obsessed, underlined, with having a baby. It's all she talks about. We went to a board-certified REI last month and he told us that he was confident that we would conceive with suggested inseminations. But my wife had 8 inseminations with her gynecologist already and now wants to go straight to IVF. I want to be supportive of her, but I think we should listen to the expert. Any suggestions? Well, with so many of these questions I get, there's a lot more that I don't know. I don't know, for example, the competency of the lab at your GYN's office. I don't know if you are on any medications. I don't know your wife's anatomic status. So there are a lot of questions I don't know. If your REI has further information or wants to use different medications or techniques, I would trust your REI, but I would put a limit on it, and that's something you can do as patients. You can be informed consumers, and you can say, well, doctor, how about if we just do 2 or 3 more inseminations before IVF? Or, you know, my wife is really eager to proceed with IVF. Is that okay with you? You and your wife need to be on the same page, and go back to your doctor and say, hey, we're not on the same page here. Can you help us get there? Why would you recommend this after we've already done 8? I am sure your doctors, you got the best doctors in the world are in Boston, or some of them anyway. So go to your doctor and just be honest and say, we have a little bit of a disconnect between the two of us. Can you help us reconcile that? Great questions. I look for more great questions to fly in the future. Thanks so much for joining me today. We look forward to seeing you here next week on the Infertility Channel. Be sure to share this video with your friends and subscribe to catch all new episodes each week here on the Infertility Channel. Plus, follow us on Facebook and Twitter. I love hearing from you. Comment below or tell me what you want to see on future episodes by sending me an email to comments@infertilitychannel.org. Until next week.